Hi, I'm going to walk you through a fake S1. So S1 is our first appointment of the evaluation, and this is fake data for a client. This is not real data for a client, and I'm using the profile from one of our psychologists. But what you'll see is a number of different sections, and you can click in and out of each section to see what's there. I strongly suggest you go in order for a long time until you get really used to everything that's there. And then eventually, when clients say stuff that's coming out of sequence, you'll learn how to jump around and put it in the right area. Until you get really used to that and learn where to put stuff, you have this little assessment scratch pad. So anything a client wants to tell you, anything that's important to document that doesn't really go in the section that you're currently working in, you can throw it into this assessment scratch pad, and then you can copy and paste it into the right section later. I also want to point out to you at the top, you've got frequently asked questions that the client might bring up. And then you also have the option to mark a session as a no-show. So if it doesn't happen, you can mark it there. This is also where you click to join your Zoom. And once you join, you'll probably need to move this script down the page a little bit or put it on a separate screen, and then use the rest of the screen to be able to see what you're doing in your documentation. So the video Zoom, I like to do it at the top. Some people do it to the side, and then the documentation right below it. Great. Well, let's talk a little bit about the content that's here. In this little snippet, I'm just going to cover the basics of setting everything up. So we'll go through 1 through 6. And then in separate videos, I'll cover the other components of the evaluation. The welcome section is really just introducing yourself and trying to make the client feel as welcome and comfortable as possible. So a very clear script for you. Anytime you see black text, that's script that you talk through. Section 2 is letting them know what to expect and giving this little warning that you might interrupt a little bit. In order to get through everything in a timely way, you will sometimes need to let people know that you don't need a certain detail, or they can give you the shorter version of a story. And it's really good to set that tone from the beginning so that it's easier to interrupt people as you go. You might find that you have a client who does a lot of extra talking about things that aren't really related to the evaluation. And you can let them know, hey, I'm going to give you a signal sometimes when I've got enough information. So if you see my hand come up, just know I've got enough to answer the question and we're good to move on. Always, of course, needing to do that in a respectful and affirming way so that people don't feel like they don't get a chance to explain themselves, but just that you're respecting their time and your time. And then this is the reminder, this next paragraph is the reminder that they do need to have their camera on, but that you also recognize they're autistic or maybe autistic and maybe they're not comfortable looking at the camera. Maybe they need to look off screen. I'm wiggling back and forth the whole time I'm talking because that's the thing my body needs to do. And you need to let them know that they can do whatever they need to be comfortable in session. When you're done with that, you click next section and you get to the next part. You'll want to confirm that they are who they say they are. You'll check on their preferred name. And then you want to ask, I need to make sure that I use the right pronouns in your report. What would you prefer that I use? And they will tell you. We get requests to use neo pronouns like Z's or other things here, and really just can't accommodate all of the different options. But if those come up, you can figure it out at that point. But if you can get to a he, she, they, them option, and even alternating is okay, we can readily accommodate that. Otherwise, we're going to need to figure it out on the back end for the client. Confirm their date of birth, and then make sure you know where they're living. And then once you confirm their state, you will get a warning if their state doesn't match a state where you're licensed. We want to make sure that where they are physically is a place where you are okay seeing them. And if not, the session will be discontinued. And then you get this little prompt to make sure they're in a quiet space. They almost always are, but every once in a while, somebody is at the playground, at Costco, just somewhere where we really cannot do psychological evaluation. And so if that's the case, we need to discontinue too. So there's a forced yes or no there. Then finally, a couple of questions just to make sure that the client is oriented and to help you understand. So the first one is, I'm going to use language in the report to describe you, and I want to be accurate. How do you describe yourself and your social and cultural identities? What do you think is important for someone to understand who you are? For some people, this will be a vital question, and they're going to give you some very crucial information. Other people might be very brief with it, and either is okay. We just want to make sure we're meeting the client where they are with how they need to be seen. And then this is a question that is more related to their mental status, but you just want to start by asking, what are you here for? What's the purpose of this appointment and what's my job? I put that at the top rather than in the middle status interview, because if something's really off about what the client thinks they're here for or what they're expecting and what you're ready to do, I'd rather you know that at the beginning of the session and not at the end. Next is saying some nice things to help the client know more about themselves and build rapport. So letting them know that you really appreciate that they're taking this step to learn more and that you're going to try your best to really understand. And then we ask if there are any hearing or vision issues. If they do say yes, then you're going to be asked via green text. So green text is for any little prompts for you or reminders for you or help for you. You're going to be asked then, what do they need for accommodation with regard to this? Many people with hearing problems have ways to accommodate themselves already, and it might not be an issue. You might notice at the bottom of my screen, it's turned red. And it says, go back to confirm identity and location section. And when I do, I find out I never actually made a pronoun selection. And I got that fixed, and then I never put this language in. So let's do that. And when I do that, you can see that the red box went away. So those red boxes are just making sure that you have every section complete. You can ignore them as long as you need to, as long as you want to. Like if there's a section that you know the client asked you to come back to at the end and you're doing that, that's fine. Next is asking, letting the client know what to expect. So it's explaining what's happening in your first appointment. It's explaining about the forms and different things and kind of talking them through the whole evaluation. And also giving a little warning that, you know, sometimes we have cases that we don't end up understanding whether there's really a diagnosis or not. So we kind of warn them and prep them for that. And then we go through the limits of the evaluation. So please read this really carefully. Number one, you can definitely recommend accommodations, but we can't make any kind of guarantee that things will be put in place by their school or their work. You can provide a short accommodations letter, and when we do this, it really is just the beginning of the report and the recommendations, and there's not really a lot of additional content. It's important to let people know that psychs don't do any additional forms. So we don't do FMLA forms or disability forms or things like that. Typically, we ask that clients go to their primary care physician or they go to a therapist who sees them over time, somebody who's got more information to bring. We're really only looking to see if autism is present or not. So we're not doing the kind of evaluation that helps us really understand the need for accommodations and in any detail, and also definitely not enough that gives us the data we need for a disability form. This is explaining the report and how that's going to look. And it is explaining you're only going to share it with the client. And then it goes into the limits of what we're going to share with people and also the limits of confidentiality in general. That should all be really familiar to you. There is a link here for clients who are concerned about privacy and concerned about their data. We've definitely seen a spike in requests for this kind of information in 2025. So just know it's there, and you can definitely share that with clients by copying and then pasting it right into your Zoom chat. Confirming that the clients say they understand, confirming that the clients consent to the evaluation based on its purpose, and then letting people know that they can do whatever they want with sharing their report, and again, explaining how you're going to share it. Then the next section I'm going to talk about in the next video. Now I'm going to walk you through the psych history section of the S1. The point of this section is to screen out anybody who has psychiatric issues that might interfere with your ability to get a good evaluation. So we start by asking if any of these things have happened within the last month. If a client says something's happened, you get a pop-up box. Causes fatigue, let's say. And then you can edit there and put in whatever details you need. But go through each of those and just check with the client. If a client says they've had a suicide attempt or other self-injury within the last month, you're going to need to go ahead and administer a suicide screen. We have a really nice one, the one that's got the best research evidence for autism, in Healthy, which is our old electronic medical record system, and you will need to click back and give it there. But when you click, and then you're able to log into Healthy, it'll take you right. Normally you'll be logged in and it'll take you right to the form, and you can do it there. I'm taking a couple of extra steps because I don't have this client assigned to me, but it takes you right through to these questions, which are the questions you need. And you can determine what to do from there. Exceptionally rare that anybody is actively suicidal, but if they are and you need support, you have a 911 crisis form that you can send to us, and you can get immediate assistance for us to help you with that. So just know that that's there. And then here you'd want to put no. Whatever little summary you needed. But the next section is about of all time, whether things have happened. So this is less about current screening and more just to understand the person more over time. So again, SI, HI, obsessions. And this is really where we're not pulling so much for interests the way we are when we talk about autism criteria, but we're going to be pulling more for OCD kinds of obsessions, maybe even, rumination like you get in depression, although that's probably going to come in the next item. But if somebody has persistent thoughts, it'll come up here. Phobias you can ask about, or we'll ask about. Delusions. I've given very lay definitions next to it so that you can define it for the clients that way. Most clients, if you say, do you have any delusions? They're not necessarily going to understand what you mean, but what you could say to the client is, are there any things that you believe are true, but your family and friends don't believe? Auditory or visual hallucinations, are there things you hear or things you see that other people in the same room with you aren't hearing and seeing? Again, with the checkboxes, anything you mark, you can put in text and be able to see it later. Any persistent negative responses to something really terrible that's happened to you in the past. Any use of substances, legal system involvement, or there is an option to mark nothing significant if nothing has come up in any of these. But most people have at least something here. For the most part, if something isn't current, they may still be able to participate in the evaluation. So for example, When you're asking about something new in the last month and somebody says they have a visual hallucination, probably they're not in a good point for evaluation. However, if you ask if they've ever had it and they say, yes, I had visual hallucinations when I was 12 and I haven't had any since, and I'm now 30 years old, I get the details and make the notes, but that wouldn't preclude somebody from going through the evaluation. Likewise, if somebody just had a manic episode and maybe even had a little psychosis is connected to that, and it was 2 years ago, and they've been stable on their medication and they're not currently having any kind of hallucination, they're likely okay to continue. Really, the only time we're going to discontinue is when the psychiatric symptoms are current, or the other consideration is with trauma, if there is very significant trauma in early childhood. So if somebody has major trauma during, toddler, preschool, early elementary years, that can also significantly affect our ability to get the developmental history and to really understand. So keep an eye out for that. But again, it has to be pretty significant trauma for it to interfere. This will kind of come in from the intake form, but you're saying, you didn't really report any prior diagnoses in the intake form. Is that still right? Or it will say you reported diagnoses of XYZ. Is that still right? Who diagnosed these? Who have you seen for therapy or treatment related to these conditions? So you want to make sure you understand if they've had talk therapy or if they've had any other kinds of treatment, that you understand what they've had. And then whatever medications will be piped in here too. And you want to check about, hey, you said you were taking Risperdal. Is that still true? You said you were taking sertraline. Is that still true? And make sure that we know the medication that they're taking. At the end of this box, you're going to see the yellow. And so yellow is where you're going to summarize everything that just happened. So if our person, let's go with that, had some hallucination in early adolescence and has never had any more and seems pretty stable, they're gonna continue. If they said that they just started Risperdal and they have a lot of sedation and maybe some confusion and they're a little bit out of it, they probably can't immediately continue, but they might be able to reschedule in a couple weeks when they're more stable. So you can then tell them what's in the script down here. We can gather some information, but I need you to do the second session when you feel better, when you're more stable, and we're going to schedule that for down the road. So we'll at least get you started today, but you're going to need more support later. Every once in a while, somebody needs immediate support. This is somebody who fails a suicide screen. This is somebody who's actively psychotic and not getting treatment for it. And then there's a script here for that. And then it takes you through the 911 form for how to manage it. So that is the section on the psych history. Almost everybody, so more than 95% of people are going to be that first yellow box. They're going to be continue the assessment, everything's fine. Fewer than 5%, something like 2 or 3% of people are going to be this, oh, we need to delay a little bit. Something's happening for you where you just can't access it right now, but you'll probably be stable and able to soon. And then even rarer still, less than 1%, are these cases where they need something more extensive right away. Okay, now I want to talk to you about number 8, engaging the client in conversation. In reality, this can happen absolutely anytime in the evaluation. Anytime there's a natural bit where it's easy to start a conversation, I want you to do it. This can happen in the S1. It can happen at the beginning of the S2. Anytime like that is completely fine. But what you want to do is pick a topic that came up naturally and ask about it to see what kind of conversation you can get going. The examples I list here are, oh, you're based in Atlanta. I love this store that's there. Have you ever been? Or, oh, you're into Lego. Have you seen the Lego Masters TV show? And what you want to do is let that interaction go back and forth for a bit before you just insert comments without questions. Like, for example, oh, you like to travel? I'm going somewhere cool this weekend. Or, oh, I have pets too. What you're waiting to see is if people ask you, or if they ask any kind of follow-up question. They may or they may not, and this alone isn't necessarily diagnostic, but it is sometimes a good way to get useful information from clients. I'm going to show you this based on the engagement you have with the client and the way that conversation goes. You're going to get these questions at the end. Did the client respond to direct social questions? So when you say, have you ever watched the Lego Masters TV show? Most people are going to respond to that, right? Maybe not, but maybe. Did the client ask you questions? That's going to be less common, especially for maybe people who have more social emotional reciprocity challenges. Did the client appear comfortable in that back and forth? Maybe a client who hasn't seemed too anxious in the session so far, all of a sudden looked really anxious when you started asking social questions, right? You'll want to note that. Or maybe they just settled right into it and started chatting away. You'd want to note that. Did the interaction feel reciprocal? Did the client pick up when you just made a statement and ask you a further question? Did it feel natural? Did it have that back and forth kind of volleying? This is going to come up later when you do social emotional reciprocity in the S2, but especially when you write the report, because you're going to have some observations now that can go into that social emotional reciprocity section. I'm just going to put some notes in here so it doesn't give me a hard time about that. Okay. So once you've engaged the client in conversation, or you've skipped that and you've waited to do that later, the next section is making sure that forms that other people completed are valid. The way we do this, and we're not going to guarantee that it's valid, but it gives us a chance to at least know who's doing these forms. Just like we would in a live evaluation, we'd want to know who filled it out, how much do they know about you, do you think they're a good resource? So you can select the relationship of the person. Really important, make sure it's an adult who's done the form. Every once in a while, we've had a parent who's had their 10-year-old try to do the form or something like that. And these forms just aren't validated for having children do them. And then I'd ask, do you have a sense of how accurately they did the form? Do you think they know you really well and would be a good judge? And then you can say, sometimes clients will tell you, my mom knows me pretty well, but she doesn't think autism is a real thing. And I think she's going to really underreport. She always says nothing's really wrong with you. I think she's going to underreport. That doesn't mean we're not going to pay attention to or use these reference forms, but it gives us that context for understanding who completed the form and what they might be like. Same thing for that SCQ. So same thing for the childhood form. You need to indicate the relationship. For this form, it's particularly important that the client is choosing somebody who is at least 5 years older and who knew them really well in early childhood. So I could maybe do this for some of my cousins who are younger than I am. But maybe for others, I really couldn't. I had a lot of cousins. I didn't know some of them very well. I certainly couldn't do it for somebody who was only 3 years younger than me, right? You need to have that age difference, and then you have to have known you in early childhood. And then likewise, you select how accurately you think they reported. This is your chance to send out then any additional forms you might need. And I definitely urge you to send out supplemental forms. We have childhood supplemental forms, adult supplemental forms, but also therapist forms. So if they mention the therapist, you can certainly send them a supplemental form too. But what the supplemental form has is questions about all of the DSM criteria and whether or not the client showed those in session or in their interactions with the person. So this is another thing that'll take you to healthy. So I'm not logged in as a client. It's a little bit of a crapshoot where I'll go in healthy. But when you're logged in as a client, it'll take you to the form requests. And when you're in form requests, you can just follow these steps and you can send it. What happens is when you request a form, the request goes directly to your client who needs to fill out a release of information. And from there, the form is emailed directly to the rater they want to have complete that release form. So you don't see anything in your email, you don't see anything in the client's file until the completed form comes back. So don't worry if you don't see a completed form right away. But if you sent the request, you'll want to check in with your clients and make sure it's getting completed. All right, the next section is asking what brings people in. Why are they seeking evaluation? And all of the most popular answers are here. These are the ones we hear all the time. So you don't have to type out the whole thing. And this will also help you when you get to the report because it'll auto-populate a sentence for you in the report related to this. However, every once in a while you get something really unexpected and you can put other for that. We don't have a text box right there, but if it does happen, you can put it into the assessment scratch pad, remember? And we can paste that in later in the right spot. So you can have that information available later, just down here from the scratch pad. And then how did you decide to get an evaluation? Did someone suggest it? So were they self-referred? Did their doctor tell them to do it? Did a therapist tell them to do it? You have those options right there. Next is going to be the cognitive ability screen, and I will pause and do that in a separate recording. Okay, this is the cognitive ability screen. Purpose of this section is just ruling in or out intellectual disability. This is not a complex IQ test. First thing is just asking people the capitals. Don't overthink it. You don't have to get them all right. It's just if somebody's really off base in their responses, we want to know. For instance, if you say, what's the capital of Canada? And they say the name of their own hometown, that's maybe a red flag. If they say, what's the capital of France? And they say Germany, might be a red flag. They're naming other countries. They just really don't get it. I'm not at all worried about the average American. You know, Americans don't have the best world knowledge, but the average American who doesn't know the capital of Egypt and they say Jerusalem, right? They're roughly in the Middle East, roughly the same part of the world. Not a great answer, but not that big of a deal. Somebody who says Krakow instead of Warsaw, I'm not going to lose sleep about it. Somebody who says Toronto for Canada, you know, as long as they're roughly in the ballpark, don't sweat it. Next is asking people to count down from 100 by sevens. So 93, 86, 79, 72, 65, so forth. We've got the answers ready. And you only have to mark correct or incorrect. The only thing you'd ever need to note here is if something completely unexpected happens, and you can always put that down here in the scratch pad, make a couple notes about it. Next are sayings. Little by little, the bird builds its nest. What does that mean? You probably have done this before in WACE, at the end of vocabulary, I think it was. But you just ask the person, what does it mean? Little by little, the bird builds its nest. See what they say. And are they correct or incorrect? The other thing I would, of course, note for this section is a really literal response, like it takes a bird a long time to build a nest. Is that correct? Well, it's factually correct, but it's not really what the saying means, right? The saying isn't really anything about birds. The next one is after the rain, good weather. Well, it's not really a weather report, right? It's saying be optimistic, look to the future. whatever. So if somebody gives a really literal response, I might say that that's incorrect, but I would definitely make a note of it in the scratch pad because that's going to be something that you want to talk about in the S2 when you get into the DSM criteria. Couple more sayings, and then just a knowledge question of social knowledge, like what do you do if you're the first person in the movie theater? Again, just say correct or incorrect. If they don't say warn others and get out of there, it's probably incorrect. But if they say something really interesting or surprising, like that's worth making a note about. But otherwise, you can just pick your selection box. And then the question is, based on their responses, based on what you've seen so far, do you have any concerns about their intellectual ability and comprehension? You also will already have had access to some of the records, so you'll probably have an idea of whether they graduated college without supports, whether they've ever had any other kinds of accommodations. You're going to have a little insight when you do this. But if you end up having concerns and worry about intellectual disability, there are more questions to complete just that help you better understand the person a little more. These are very standard, very similar to what you'd see in a Wechsler IQ test. So I'm not going to go through all of them, but you can read through and I don't think they'll surprise you. When you get done with the IQ section, really you just say there's no concerns, which again, more than 95% of people, there are no concerns. Every once in a while, you might have possible concerns. And then if you have significant concerns, that's when it's important to not proceed until you get some consultation. So talk with a lead in a drop-in meeting or seek other consultation to make sure you get a chance to talk with someone about that. All right, so it took me back to that section. Okay, emotional processing is next. Yeah, that's right. This you might recognize. It's very similar to the questions from an ADOS, but structured a little bit differently. But what we want to do is really see how well the client can talk about their internal experience, whether that affects their facial expression, and what insight do they have into how they experience emotion in their body. So you'll ask about the emotion, you'll note any change in facial expression with these options here. And then you'll ask the next question and you go through and you're looking to see what you see, but you're also listening for what they tell you. When you get to the end of this section, I want you to rate the insight the person shows as well as their connection of their emotions to their physiological sensation. So if they answered questions about as you would expect, you could say adequate. If sometimes it was a little difficult for them to recognize and talk about their emotions, you would say the middle one. And if for the most part across the board, they just couldn't do it or it was very, very minimal, you would say the last option. And then here too. Really, if they're able to connect emotions to physiological sensations, great. I would say this is about a 75 or 80% or better. Somebody who's maybe more like 50 to 60%, you do this middle option, and somebody who just can't connect is down here. And just to give you an example, when you ask something like, how do you feel when you're angry, right? Most of us can say, well, I feel tight. I feel like my muscles are clenching. I might even squeeze my fists. I feel like I'm seeing red inside. So something kind of descriptive like that. And that's really what we're looking for here, to connect the emotion to how their body feels. Great, just 2 more sections of the S1 here. This one is about their current situation and future hopes. So ask what they're doing now and how they enjoy it. There's some prompts there you might find helpful. What do they want to be doing down the road? It's okay if they have no plans. They don't have to have plans, but if they do have plans, we want to know, like, can they think through the steps of what they want to do? Do they understand it? So do they have that comprehension of what it takes to reach life goals? What do they think their ultimate dream job would be? And maybe they have it. Maybe they're doing something they really love and they can talk about that, but it gives you a really good picture into what their current life is like. question next is just about how independent they are and what kinds of support they need. Depending upon the client, you might get questions like, it's all automated and online. You might find I'm always late, I forget to pay bills. This gives you a little bit of insight into, both how independent they are, but also what their executive functioning is and how are they compensating for any challenges they might have. And then this one is about pet peeves. So it's a little bit of a jumble here with different questions, but this is just something that starts to get you a little social insight. What are some things that other people do? Like, what are pet peeves that really get to you, really bother you? And then are there things that you do that bother other people? That is a question that also shows up in the ADOS, and I think can be really helpful for understanding how well they can do perspective taking and think about other people. Okay, last part for this section is early history. It's really, really hard, and we explain this here, it's really hard to take an adult and understand what they were like as a child, but you want to know some of their memories and what they can recall, because that's going to help us better put it together and understand. So the first question is about play, and you get some options here. This could be a select all. So if they say multiple different kinds of play, mark all of them. If they say, for instance, you'll see solitary and repetitive together quite a bit. You might get partnered and pretend together quite a bit. Whatever they say is okay. Just do the right check boxes. The next is asking about the kinds of therapy they got in school, if they got any other difficulties they might have had, but maybe never ended up getting therapy for. And then you're going to jump ahead to 10 and ask about play at age 10. What did you do in your free time? What was it like when you got together with other kids? And then now you'll see it's not just about the play, but also who's starting the activities, who's making the plans. And then at 15, it really changes a lot, more like what teenagers do when they get together, and asks about that. Asking if they've ever been in trouble at school, and then if there's anything else about early development that we haven't covered. Now you're going to do the masking and camouflaging interview. There are some rating forms that get at camouflaging and masking, but they aren't great. They don't have very good psychometric properties, and honestly, they pick up a lot of social anxiety. So we've elected to go with an interview instead to try to better tease that apart. So the first question is, how did you learn to do, or what to do and say? How do you decide what to say? There are going to be a few of these questions here. And at that point, after those first few, you should have a pretty good sense of whether or not there's masking and camouflaging happening. However, if you don't yet have a good sense about it, you can ask additional questions. You saw when I clicked yes, I got more questions, but if I had clicked no, I would be done with that section. So it's really up to the client's responses and what you're hearing back from them. Clients tend to fall kind of in one of two buckets: the ones who talk about doing a lot of masking and working really hard at it, and the ones who really don't even think to do it. It doesn't occur to them. So most of the time, you should have a pretty clear idea before you get to the CLO section. And then this next section is the mental status checklist. So this is something you do when you're finished with the client, but you know how they were dressed for the occasion, how they appeared to be groomed as well as you can tell, how alert they seemed, whether they were engaged and participated in the session, what their use of eye gaze was, what their affect was like, whether their affect was congruent with what they were talking about, or were they, laughing when talking about a death in the family or whatever, incongruent. What was their comprehension with language? This is often really helpful to think about when you're thinking of that cognitive question. Somebody who needed almost all the questions reworded to support their understanding and they didn't do well with the cognitive questions is probably somebody with an possibly somebody with an intellectual disability where, we would want to be really cautious about whether or not we proceeded. And what's the client's use of language? And then any other notes from your observations you want to put here would be really helpful. And then this next section is the one we already talked about earlier when we did the conversational press and tried to chat with somebody. When you get done with all of that and you clear all of your red boxes from down here and make sure you've answered all those questions, you can click the box to mark that S1 is occurred, and that will end your first S1.